I'm just going to verify some orders to my MAR for my patient Shirley Cost. The doctor's ordered lactated ringers 1,000 milliliters with 20 milliequivalents of potassium chloride IV. So I have this in my MAR. Lactated ringers 1,000 milliliters IV with 20 milliequivalents of potassium chloride. And then I have morphine sulfate 5 milligrams IV push every 2 hours. Morphine sulfate 5 milligrams IV push every 2 hours. So the provider's orders do match my MAR, so I'm going to go ahead and get my medications ready. So I have here my my lactated ringers. It has my patient's name and date of birth on here, and that matches Shirley Cost 5/14/64, 5/14/64. So this is already prepared by the pharmacy, 20 milliequivalents of potassium in 1,000 milliliters of lactated ringers. The bag has not been tampered with. There is no leaks or tears, and the solution is clear, so that's good. And then we have our morphine sulfate. So I have my morphine sulfate here. This is 10 milligrams, and we do need to dilute it. I've already done my math, and I know that I need to drop 0.5 milliliters to dilute into 5 milliliters of normal saline. So I will get that ready, but morphine 10 milligrams per milliliter. So we'll do that. So I'll go ahead and get my gloves on and get these ready. And I have checked my lab values to make sure that this medication will be good to give, and it is indicated. The potassium of my client is low. And then I have already done my thorough pain assessment, and I know that my client is needing the morphine, and I've checked and it was given over 2 hours ago. Start with this. Okay. So I'm going to waste part of this. So I've wasted part of that, replace this. And I'm going to get my syringe ready to draw up my morphine. So I would clean this for 30 seconds. For the sake of the video, I've cleaned this for 30 seconds. And I'm going to pull back 0.5 milliliters of air to insert into my So I would use my pen to get the air bubble out. So I'd make sure that all of the air bubbles are out, which they are. So I can pull this out. And just so you can see the 0.5 milliliters there. And then I'm going to put this into this into my and this will go right into the sharps. to be sure that all of my air bubbles are out. And I would put a blue tip on here. And label this. And it is 0.5 milliliters morphine. So then I would label my syringe. And that is ready to go to my client's room. So I'll grab my IV tubing, my flushes, and the label for my tubing. My gloves. Discard this with another nurse. Alright. Knock knock. Hi Shirley, my name's Amanda and I'm going to be your nurse today. I have a few medications here that the doctor has prescribed for you. You're still having your pain, correct? Perfect. Alright, so I'm just going to have you verify your name and date of birth, please. Perfect. How you feeling? Still having pain? Okay, well we'll get that taken care of for you. So I'm just going to do my third med check here at the side of the bed. So the doctor's ordered the IV fluids with the potassium in it for you. So we're going to do the 1,000 milliliters of lactated ringers with 20 milliequivalents of potassium, 200 milliliters per hour. And then we have the morphine here. Morphine, 0.5 milligrams. IV push every 2 hours. Okay, perfect. All right, Shirley, so I'm just going to go ahead and get this medication started for you, but I'm going to start by flushing your IV. Does it hurt at all? Okay, perfect. Alright, Shirley, so I'm just going to clean this. I would clean this for 30 seconds. I would flush, making sure that the IV site is patent. There's no swelling, no pain with that. Okay, perfect. So then I would discard this. Alright, and then I'm going to go ahead and get this IV solution started. So I have the primary pump tubing. Make sure that my disc is closed. Spike my bag. Loosen the cap here. And I'm going to start with my disc inverted. So I'm going to open this. Once the side is filled, we're going to flip it. And we're going to make sure we get all of the air bubbles out. bubbles are out, so this is ready to go. So I would insert this into my pump and I would program my pump. I've already done my math, so he wants it at 200 milliliters per hour, so I would put 200 milliliters per hour for the rate, and then for the volume to be infused, we would do 975 so that we have some time to get a new bag and hang it before it runs out. So, got this ready. Go ahead and clean my site. Connect these. All right, Shirley, how you doing? Perfect. All right, so then I'll come back and check on you in a little bit, okay? Great. Oh, we have your morphine to give. Sorry about that. So I would wash my hands. All right, Shirley, so I have your morphine here that we're gonna give. Oh, I would label my tubing. And then I would write my IV start time. All right, and then we're gonna go ahead and stop the pump, and so we can give the morphine. So I've checked my medication to my MAR and done my pain assessment. So I've stopped the pump and I'm going to flush my IV line. To make sure that it is patent. Get the remaining medication out. It. And now I'm going to do my morphine, and I've done my calculations, and I need to push the morphine over 5 minutes. So as I'm pushing the medication, I'll go slowly. As I'm pushing, I will watch my client, observe for respiratory depression, and ask them how they're feeling, make sure it's going okay. So now that I have pushed this over 5 minutes, I'm gonna go ahead and flush. And while I flush, I need to make sure that I am not flushing quickly. So I'm gonna flush at the same rate that I was flushing the morphine, or that I was pushing the morphine, so that the client doesn't get an overabundance of the medication at one time from this remaining IV line. How you doing, Shirley? Pretty good? Okay. So I would also push this slowly to make sure that the client is not getting too much. So now that I've flushed, I can go ahead and restart my IV fluids at 200 milliliters per hour, making sure that I come back in 30 minutes to reassess my client's pain. I will document start and stop times of the IV fluids, and I would document start and stop time of the morphine on my MAR here. And then I would also initial here at the bottom and sign my name, since we need to have our name and initial. I would also document how the client tolerated the procedure and document the pain assessment afterwards.